Diaphragm. Introduction. In the anatomy of mammals, the thoracic diaphragm, or simply the diaphragm, is a sheet of internal skeletal muscle that extends across the bottom of the rib cage. The diaphragm separates the thoracic cavity from the abdominal cavity and performs an important function in the respiration. As the diaphragm contracts, the volume of the thoracic cavity increases and air is drawn into the lungs. Functions. The diaphragm function is breathing during inhalation. The diaphragm contracts and moves in the inferior directions, thus enlarging the volume of the thoracic cavity. This reduces intrathoracic pressure. In other words, enlarging the cavity creates suction that draws air into the lungs. Innervation. The diaphragm is primarily innervated by the phrenic nerve, which is formed from the cervical nerve C3 to C5. An useful mnemonic to remember this is C3 to C5 keep the diaphragm alive. While the central portion of the diaphragm sends sensory afferents by the phrenic nerve, the peripheral portion of the diaphragm sends sensory afferents by the intercostal T5 to T11 and subcostal nerve T12. Variations. The sternal portion of the muscle is sometimes wanting and more rarely defects occur in the lateral part of the central tendon or anodyne muscle fibers. Development. The thoracic diaphragm develops embryological beginning in the third week after fertilization, with two processes known as transverse folding and longitudinal folding. The septum transversum, the primitive central tendon of the diaphragm, originates at the dorsal pole of the embryo and is relocated during longitudinal folding to the ventral thoracic region. Transverse folding brings the body wall laterally to enclose the gut and body cavities. Clinical relevance. Failure of one of the ferroperitoneal membrane to the form of a competent barrier between cavities can result in congenital diaphragmatic hernia. This condition is presented in 1 out of 2,000 births. A large herniation has a mortality rate of 3 or 4 and requires immediate surgical repair. In the pathology, the right cross of the diaphragm is a part of the lower esophageal sphincter, which separates the thoracic and abdominal parts of the esophagus. A hiatal hernia, in which the abdominal esophagus or even the fundus of the stomach rises up through the esophageal hiatus into the thoracic cavity, can result from a tear of weakness in the diaphragm. Weakness may also result from injury to the neck at level C3 or C5, which can result in a severed tone of either half of the diaphragm. Both general weakness of the legs and the hiatal hernia can cause acid reflux, also known as gastroesophageal reflux disease.